Hello everyone, this is Dr. Rebecca Glasser coming to you from Grand Junction, Colorado. Just so you know who I am, I've been a plastic surgeon now for 21 years and have been doing Botox and filler for all 21 years. So I wanted to come to you today with Tuesday's beauty tips. I thought we would venture a little further into our talk about Botox. Many of you all have heard about Botox, but I wanted to talk a little bit more about, okay, what areas can I use Botox in? So typically when we're using Botox, we do it in the upper face. We've talked before about how we address the 11s, but the other area we often use Botox is in the forehead. So if you would please, there she goes. She can raise her brows, and as she raises her brows, you can see she has these horizontal lines which are helping her to raise her brows. Now, what's important, you can relax, about this area is that the muscle itself, the frontalis muscle, actually spans the whole level of the forehead. So you don't want to spot treat, because that will give you some abnormal movement of the upper forehead. You're going to treat the whole forehead. But at the same time, you want to make sure that you don't do anything to drop the brows lower. You know, we don't want to create that more masculine look of those brows dropping. So we want to span the whole forehead. And then for some people, we also can create a little bit more of an arch in the eyebrow. We like for that last third of the eyebrow to come up. So sometimes we will treat a little bit just under the brow itself in order to create more of a lift. All right? So as we look at Botox, Botox has been around for a long time. It's been around since the 1970s. I love drugs that have been around for that long because we know if they're going to have complications. I use Botox, which is made from allergan. It is a series of very small injections that we use. I use the smallest needle possible, and we're going to treat the entire forehead. Then that result, that smoothing of those wrinkles, is going to last for about 3 to 4 months, and then you're going to come back in and we're going to do it again. We do see that these lines can have memory. So if you're only doing it once a year, once every couple of years, you're really not treating those lines. You want to get on a maintenance program where you're going every 3 to 4 months to have this treatment done. If you would like more information on this, we're going to put our numbers below. We have, of course, a clinic here in Grand Junction, Colorado, and we also go down to Montrose in order to help with the locals there, so you guys don't have to travel all the way to Grand Junction. Please comment below if you'd like more information or if you'd like to make an appointment to do a free consultation. This is Rebecca Glasser. Thanks so much for joining us.